Thank you guys all for coming. My name is Dr. Lisa Mattson, and I'm president of the Minnesota Medical Association. With more than 10,000 members, we are the largest professional association of physicians in the state. We represent doctors from every corner of Minnesota and every medical specialty. Our members have dedicated years of training, decades of medical practice, our entire lives to keeping Minnesotans safe and healthy. That's become harder and harder to do given the state of gun violence in this country. Do you know that the leading cause of death for children in the United States is not a biological disease? It's not cancer, not car crashes, not overdoses. It's guns. Gun violence is the leading cause of death for children in the United States. We all witnessed horrific violence over a month ago in Minneapolis. Following that event, physicians across the state, including our organization and several others, sent a letter to Governor Walz and legislative leaders urging them to gather in a special session to pass 4 evidence-based firearm safety policies. Collectively, these policies will lower the rate at which Minnesotans die and are injured by firearms. The policies include, number 1, a full statewide ban on assault weapons. 2, a statewide ban on high-capacity magazines. 3, a statewide requirement that firearms be locked, unloaded, and stored separate from ammunition. These are known as safe storage laws. And 4, the removal of current prohibition on local municipalities from enacting stricter firearm regulations than the state. It has been a month since we sent that letter, and lawmakers have yet to convene in a special session. This is no longer a friendly request from your local doctor. This is a demand from the tens of thousands of physicians across the state who know firearm violence for what it is, a public health crisis. The Minnesota Medical Association, along with a broad coalition of healthcare organizations, collectively demand that Governor Walz call a special session to pass these evidence-based bills. Thank you. I would now like to ask Dr. Tim Coomer to speak next.
Good afternoon. My name is Dr. Tim Coomer. I'm an emergency physician at Hennepin Healthcare and Assistant Medical Director of Hennepin EMS. On August 27th, I was the first physician on scene at the Annunciation school shooting. When I arrived, I joined our paramedics in assessing children who had been shot in the back, arms, and head. As we took in the immense pain and fear in the eyes of those children, we tried to comfort them as they were rushed to the hospital. Once the critically injured had been transported, our focus shifted to children who said they were uninjured, though their uniforms were soaked in blood. We had to confirm whether it was their own blood or the blood of their classmate that they had tried to shield. I have cared for many victims of gunshots and been on scene for many multiple mass shootings. But what was different that morning was that these were children. There were many children in church. At Annunciation, I saw the horror in the eyes of these children. I saw the fear of parents desperate to know if their child was alive. And I heard the screams of mothers and fathers when they were told their child had been murdered. Those memories do not fade. At Annunciation, an assault weapon multiplied the number of children shot, turned minor wounds into life-threatening ones, and amplified the trauma for families, first responders, and healthcare workers. Gun violence is nothing new to our society, certainly not to our Black and brown communities that we serve. They have lived with this painful reality for decades. For those who say gun violence is a complicated issue, it isn't. You can make it complicated by blaming mental illness, but the truth is mass shooters are rarely suffering from mental illness in the way that we think of it. They are often lonely, angry, and isolated. Blaming mental illness only stigmatizes those already struggling. You can make it complicated by arguing that our schools need enhanced safety entrances. This lacks evidence and makes our schools feel like prisons rather than a welcoming learning environment. This is a public health issue, and we know how to address public health issues. We follow the evidence, and the evidence to this public health issue is clear. Limit access to certain weapons. Weapons that by design cause more victims, not less, with more severe injuries, not minor, creating more trauma for everyone who responds and cares for them. One of the patients I cared for at Annunciation was a 12-year-old girl with what looked like a simple grazed wound to her head. On the outside, it looked like a small abrasion, nothing else. But despite that bullet never entering her brain, the energy from that weapon was so powerful that it caused life-threatening bleeding, and surgeons had to remove part of her skull. From a handgun, that wound would likely have been just a graze. From a high-powered rifle, it became life-threatening. I am not a gun expert, but I am an expert in the aftermath, in the pain and suffering that goes beyond the patients and families who carry these scars. Every time there is a mass shooting, the trauma lands on the shoulders of first responders and healthcare workers. It erodes our ability to cope, our ability to sleep, to keep coming back to this work, and some of us never come back at all. These weapons turn survivable injuries into fatal ones. They turn small tragedies into mass tragedies. Inaction on this topic is not neutral, it is acceptance. I am asking my fellow Minnesotans and our elected officials to listen to us and to act. Limit access to these weapons in the name of health and safety for our children and teachers, for our first responders and healthcare workers, and for all in our communities. Thank you. I'd like to welcome Dr. Velisic of Minneapolis Children's.
Good afternoon. My name is Trish Velisic. I am a pediatric general, thoracic, and trauma surgeon in private practice working primarily at Children's Minnesota, and I'm now in my 16th year working there. As a level 1 trauma center, Children's Minnesota has a pediatric trauma surgeon physically in the hospital 24 hours per day. On the morning of August 27th, I was the trauma surgeon on duty. I was just finishing rounds with my team when I received a trauma alert stating we were receiving a 10-year-old with a gunshot wound to the head. I have unfortunately cared for many children with gunshot wounds. It is rare for school-aged children to be shot in the head at 8:30 in the morning on a school day. So I had a gut feeling we would be dealing with a multi-casualty event. Minutes later, I arrived in the emergency department and was told we would indeed be receiving multiple children from a shooting at a school church. I called the operating room and told them to not start any other surgeries, obviously finishing the ones that were ongoing, because I needed rooms available if we needed them. I notified my partners that I might need their assistance. Our first patient arrived and the next 4 were right behind. In fact, on our records, they all have the same arrival time. We went from quiet to controlled chaos in a matter of moments. When multiple children arrive at the same time, we use triage protocols to determine the order in which they are treated. The American College of Surgeons has triage guidelines for such events that we have learned over and over again. Depending on how many patients you receive, the protocols change a bit. For example, you might not put all of your resources into the most injured patient if it means other less injured patients might die. Can you imagine applying these protocols to someone's child? Fortunately, on August 27th, we did not find ourselves having to make that decision. We were able to get every child into a room with a team dedicated to them. My job in any level 1 trauma and during mass casualty events is to direct the care. On that morning, I was able to get quick assessments on each child and determine who needed further evaluation or management first. There is a saying in pediatrics that kids aren't just little adults. They have a different physiology, and you can't just treat them the same. The saying certainly holds true for gunshot wounds. It should be obvious, kids are small, and this can make the injury they incur more severe. In an adult, a bullet will cause injury along its path, but because they have more visceral or internal fat, it will be somewhat insulated by the surrounding tissues. This same bullet will do more damage to a child because they don't have that extra protection. Add in the factor of high-velocity ammunition, and the path of the damage widens further. I really hope I don't need to give a more graphic description of what a bullet does to a child's tiny body to get the point across that it is bad. There is another, I think, bigger difference between gunshot wounds in adults and those in children. In the whirlwind of August 27th, there are a few things that remain vibrant and crystal clear in my brain. They are what still wake me up at 3 a.m. The looks of absolute terror on the faces of the children we received in a wave, in shock and bleeding, without their parents to comfort them. And then the second wave of terrified, panicked parents not knowing if their child was even there or had survived. We are so fortunate that we had an incredible team of child life specialists to help calm the kids and social workers to help the parents. And I thank my lucky stars that this time I did not have to hear that anguished scream of a mother when I told her that I could not save her child. I have had to do that too many times. I've had some time to reflect on what happened to our community. I am angered that my initial thought upon hearing that we were receiving multiple children from a school shooting was, we knew this would happen to us someday. How do we live in a society that knows this will happen again and does nothing to prevent it? We cannot let this moment pass without making a change, without moving our feet, as the families from Annunciation have asked of us over and over again. Since 2020, gunshot wounds have been the leading cause of death among kids ages 1 to 17 in the United States. Not cancer, not car crashes, not peanut allergies, gunshot wounds. The rate of gun-related deaths in children has increased 106% since 2013. We now average 7 per day. And it is preventable. It is entirely preventable. We just need to care enough about our children to do it. Thank you. And now I'm going to introduce Dr. Gophers O'Brien.
Hello, my name is Dr. Jana Gophers O'Brien. I am a pediatrician. I am a mother of a beautiful 9-year-old, and I'm the president-elect of the Minnesota chapter of the American Academy of Pediatrics. Our chapter is comprised of pediatricians across the state who care for kids day in and day out. We join in calling on our elected officials to come together in a special session because our members have treated too many kids with gunshot wounds, had too many devastating conversations with parents and family members, and watched too many children die. As a pediatrician with expertise in adolescent medicine, at a level 1 trauma center, I have been treating victims of gun violence long before August 27th. In my primary care practice, I care for multiple patients with spinal cord injuries, brain injuries, and long-standing disability as a result of gun violence. Then, 1 mile from my home, after dropping my 9-year-old off at school that morning, just a few miles away from this, on August 27th, the grave and preventable events that you've heard about today happened at Annunciation. And it shined a light on this epidemic for everyone to see. Maybe for the news cycle, this was a one-day thing. But for the children and families that were involved that day, and for the healthcare providers that cared for them, these will be wounds that may last a lifetime. I have treated victims of gun violence for years after they've healed from their bullet wounds. These wounds are deeper than flesh. They last, that psychological trauma that victims of gun violence experience lasts for years. They are wounds that last a lifetime. That trauma is not just limited to victims. It spreads like a virus across communities. So now, in addition to treating the victims of gun violence in our community, we also are treating countless children who should be focusing on their ABCs, or adolescents who should be thinking about what they're going to wear to homecoming, and instead they're afraid to step out of the door because they're worried they might be shot. And you may think that that's wild, but this is actually justified with where we're living currently. We've seen kids get shot at church and at school, and we've seen kids get shot when they went to the park to play. That should not be what we're living in, and we owe it to the children we are with, that we care for, and the children we're raising, to protect them. And we know what to do. We know how to protect victims of gun violence. Unlike other medical conditions that we all treat here, this is not that complicated. We must write this prescription today, and this is a prescription for Minnesota lawmakers. Come together in a special session and pass these laws now. If not, our kids, my kids, your kids, will continue to die due to firearms at alarmingly high rates. As we've heard earlier, it's the #1 cause of death among U.S. children. That is unacceptable. I'm going to close on a personal note. Some of you may not know, but this is the holiest day of the Jewish year. It's Yom Kippur. It's a day where we mourn the dead, and we reflect on the year that's passed, and we think about what we can do better and what could come in the year to come. And when we look back, we think about unimaginable atrocities. But when I look forward, I think, and I hope, that a year from now, we can celebrate the action we took today and the action we take over the next several months to make an actual difference on this issue. I hope that when we look back, we won't be mourning the children that died of gun violence in the year past. We failed to protect them that day, but we won't fail anymore. Thank you all for being here, and we'll take questions from here.
I'm just curious to know from what you guys have seen from news and have heard from lawmakers, if you are
I think sometimes politics gets in the way of good sense. We are not, as doctors standing here, we are neither red nor blue. We're not coming at this as Democrats or Republicans. We're coming at this as unabashedly pro-child. And I think if we all put our politics aside and think about what makes common sense here, that we all know what to do.
AMA has been asking for this type of gun reform since at least 2012. You talk about a 106% increase since 2013 in this gun violence for children. That's 13, 14 years now of asking for this same type of change, and it's not happening. Is that, what do you attribute that to?
Again, I attribute it to people's politics getting in the way of good sense policy, and I had never hoped that we would, and I never hoped or wished that we would ever have a mass casualty event, but I would hope that now that we've had multiple children gunned down in schools and in church, that people will finally put those things aside and take action.
Have you all had any meetings with the governor or lawmakers or?
We've been meeting and in communication with governors and lawmakers for a long, long time, over a decade, but especially since August 27th, and we are calling for this, and actually all of our medical organizations are on board with this because we recognize it for what it is, a public health crisis.
Yeah, I'm just curious, like, what are they telling you as politics seems to be clearly getting in the way again?
Others? I'm happy to answer this one too. I hear a lot of empathy and then not a lot of action.
Have you spoken with any Republicans?
We have been speaking with everyone across the aisle. This is not a political issue in our eyes. This is a public health crisis.
Can you guys talk, two of you at least, were treating patients from Annunciation. You talked a little bit about how traumatic that may be, but can you kind of, just give us a little more insight into where your headspace is now?
Okay. What do you mean?
Like, you saw these people, I know you've seen it before. It's
Right.
part of your job. What does that do to you on a daily
Yeah.
basis? It's more than a month out now.
Right.
You're still seeing this?
No, I appreciate the attention on that. It's not part of our job. Responding to a church full of shot kids is not part of anyone's job. I've struggled with that. I signed up for this job. I love this job. I'm so grateful for this job. I'm grateful for where I work. So why would I do something that makes me not sleep at night, that makes me have a hard time talking to neighbors? I live right by the school. Nobody signs up to go to a church full of shot kids, right? We have police officers, we have firefighters, we have paramedics, we have nurses, we have healthcare assistants, we have physicians, we have across the board who can't do their jobs because of what happened that day. It's terrible, to be honest. I'm very grateful that I think healthcare has evolved to understand the impact this has on us, and they're doing what they can, but that's really far downriver, right? The way to make us not need trauma therapy on a regular basis is to ban weapons that let them shoot 160 bullets in 2 minutes. It's hard.
As was just said, this is not what we train for mass casualty incidents. Obviously, that's part of our job. But again, having 5 bloody shot children arrive at Children's all at once, all of whom were the same age as my children, one of whom had the same name as one of my children, is very difficult. And pulling yourself away from that in the moment is part of our training. We also have lots of resources for ourselves afterwards. But it doesn't go away because this should not be our normal. It isn't our normal. And so it does continue to wake us up. And I know from at least enough of my training regarding what's going to happen to me that I may feel better for a while and it's going to come back at some random time, months or years from now. And that is true for every single person who was involved in this. So when we talk about the children, clearly the children are the most important ones here, but the effects that this has on the community and those who take care of these children goes on for a long time.
You guys have hope here? It's, like I said, Sandy Hook was 2012. AMA has been asking nothing seems ready to happen. Is there hope?
I wouldn't be able to come back to work if I didn't think there was hope. And I honestly, in my head and in my heart, think Minnesota could finally be the place that does it. That's what I'm holding on to.
This is the land of Minnesota nice. You know, let's hope that with something bad finally happening in Minnesota, which we never wanted to happen, that we're going to pull together and make something bad, something good, and finally get something done here. We've got evidence-based, common sense policies that we've asked for. And let's hope that finally something's going to happen. And we're hoping that after today, we're going to get our message across and we're going to get this special session and make something good happen. So that we don't have anything like Annunciation ever happen again in this state.
Can I add to that? I just think it's really important that we acknowledge that the frustration that I think we all feel that it took a school of kids being shot for us to be here, right? Our community that Hennepin serves, this is day in, day out. We had a mass casualty of shooting the day before Annunciation. That was a small blurb in the news. And we have communities that live in this every day. And it would be a tremendous waste of our agency to not have hope. We have to have hope, because what else are we doing? We owe it to our communities. I owe it to my 5 kids. I owe it to the kids of Annunciation, the families of Annunciation, to have hope, because that's what brings us here day after day.